welcome back to my channel. My name is Vivian Oseni. On this channel I talk about everything nursing, lifestyle, motherhood, beauty, and all that good stuff. Today is interview questions for nurses who are writing examinations. I've had a few subbies who've come across me asking me questions about interviews for nursing in the UK. So here goes. If it's your first time coming across this channel, do well to hit the subscribe button and the notification button to get subsequent notifications when I post new videos. So let's get right into this video. Going for an interview is something that can be very daunting for a lot of people. However, I want to let you know you can do it. Just breathe in and breathe out. Okay? All right. First and foremost, you have to be confident, know your onion, and you have to show that you're confident, you're competent, and that you know what you are doing. Now, my first tip when you go into the interview is that you should not take any interview for granted. Even if it's a Skype interview, dress appropriately. Dress appropriately. Dress to be addressed. So dress appropriately for your interview and be on time. Be on time for your interview and be there at the right time. Text your connections and ensure your connections are working appropriately. Even if it's for that interview alone, ensure that your connections are appropriate and everything is working before the interview begins. Test it out with somebody or by yourself and ensure it's working appropriately. 2. Prepare ahead of time. Know the company or the organization that you are going to interview for. So if you're interviewing for NHS hospital, go onto their website and read everything you can about nursing, about the whole hospital as a whole, about new policies, about their visions, their goals, amounts of staff they have. Just Google and read everything that you can get about the hospital beforehand or the care home beforehand. Do your homework about the place you're going to be working for and what you can find out, because once you show them that you know about them, they'll be more interested in you because you've gone ahead to do your due diligence to find out about them, which makes them know that you're interested in this job and you really want this job. Alright, so your nursing interview could actually be scenario based or direct questions thrown at you. Always focus on the C's of nursing: teamwork, competence as a nurse, and your understanding of policies and your understanding of following due process. So very paramount for every nursing interview is the C's of nursing in the UK. Most nursing interviews are going to focus on the C's of nursing, the 6 C's of nursing, which is care, compassion, competence, confidence, communication, commitment to giving absolute wonderful care, and your courage. So you have care, compassion, competence, communication, courage, and commitment. So whatever you're answering, try to ensure that you're focusing this around these 3 C's. Another point you need to focus your questions around are the core values of the trust or the NHS or the care home in which you are going to work with. So if you're going for an interview in the NHS, find out the NHS trust values and policies and also focus your answers around them. And if you're going for a care home, look for their values and their core policies and their care values and focus your answers around this. This just shows that you're somebody who is going to follow policy to the letter and is going to promote the vision of the organization. Why did you decide to become a nurse? Well, you can answer this question by saying that you decided to become a nurse in order to assist people and to assist the environment, and also to assist and empower people and help people to help themselves. You know, you can actually be given various scenarios in which you give your function as a nurse, and by so doing you're adding value, and this is why you love your profession as a nurse. And this ultimately is the reason why you've come into nursing, because you're somebody who's caring, who's compassionate, and who is always looking for avenues to make people's lives better and give people a very optimum state of health and give them advices on their health. And what are the most proud moments you have in your profession up to date? The best way to answer this is a scenario that shows that you have gone above and beyond in the care of a patient and ensuring patient safety. Those are the kind of things they want to see, where you've given the best care you can to a patient or saved the life, or due to your communication, somebody's life was saved. How do you manage and prioritize tasks? Well, in this you have to show that you're a team worker and somebody who's going to work well in a team. So whatever it is you're answering, ensure you're showing them you're somebody who works well under pressure and who works well in a team, such as being able to delegate tasks, being able to assign roles, and being able to do your jobs in a timely manner, and being able to prioritize care according to life-saving cases to those who are not life-saving, choosing your cases case by case, but ensuring at the end of the day that everybody gets the optimum care which they deserve during your shift or during your care in the hospital or in the care home. Is what sort of feedback would I get from patients if I ask them about you? Well, in this question, you just have to give them like a scenario or as an example of where a patient has spoken highly of you and has done something, probably given gifts or whatever, probably when you give birth to a baby or anything. Just look for a scenario where you know you're giving a good care and the patient was very, very happy and gave a good feedback to your manager or to your employer about you. All this happen every time in nursing, so this shouldn't be a difficult question for you to answer. If a colleague does something wrong to a patient or to a fellow colleague, what will you do? In this question, they're trying to test your integrity and your ability to report situations and anything that goes wrong with your patient. And how do you answer this question? First, you have to let them know that you know the due processes and the policies concerning duty of candor first as a nurse, and which is embedded in the Nursing and Midwifery Council, where you have to have a duty to ensure you let the patient know that you've done something wrong, and also you have a duty to also speak up about the wrong and safeguarding your patient and ensuring that wrong does not occur, and also going ahead to an incident report of what has happened so that the managers can do the appropriate thing to prevent that incident from occurring again. Ultimately, they are just trying to find out if you're going to make decisions in the patient's best interest, no matter what the situation, and that you are trustworthy, and ensuring that you have also reported that situation to the most senior manager in your organization. How do you intend to continue and manage your professional registration and revalidation? What they want to see here is that you're going to ensure that you always legally practice in the confines of your profession and in the confines of your validity. They're going to do your validation as at when do you with the Nursing and Midwifery Council every 3 years, and they're going to ensure that you pay your registration and be up to date with your registration, because once you're out of registration, you are not allowed to practice as a nurse. So it is your duty to ensure that you keep your registration up to date and to ensure that your validation are done appropriately and at the right time, quickly, and to ensure that you are always a valid practicing nurse. Also ask, why did you choose this specialty of nursing? For instance, you're going to a care home or you're going to NHS or the surgical department. They could ask you the question, why did you decide to choose to come into this department? Well, in this kind of questions, you just have to tailor it to that department where you've chosen. If it's a surgical unit, you can say you have a passion for caring for people who have probably bowel problems or appendicitis. You find it comforting and fulfilling to work in that setting. If it's in the dementia care or in the elderly care, you can say, or in the care home, you can say you love working with elderly people because you have elderly people at home, you've worked in these settings before and you found it fulfilling. The point is that you have to portray that you are happy working in that setting. And if it's in the mental health situation also, you can also say that you love these settings because it helps you to understand the way the human mind works, the situations that can go wrong, how to understand the human person, and how to help them when things go wrong. So these questions can be asked you why you've decided to go into the specialty. What you just need to demonstrate is that you're passionate about the specialty and that you are motivated to work in that specialty at any one given point in time. What are your strengths and your weaknesses? Now with this question, you just have to focus on your strengths, of course, being able to work on the stress, being able to go out of your way to do things for people. Now, when it comes to your weakness, an example you can say is that it is your unwillingness to say no, even when you know it's very difficult for you to say no for jobs, so that you go out of your way to do the jobs, even extra hours, just to ensure that the organization is working smoothly. However, you don't see this as a very bad weakness, because at the end of the day, you're giving your due best to the organization and to the patients. So even if you mention a weakness, try to tailor it to something that is good. That way you're not giving a very bad weakness about yourself that's going to make the employer go like, ooh. So it's a very tricky one. Look for something that feels like a weakness, but at the same time it can turn into a strength when you're giving your answer. What questions do you have for us? Well, don't forget to ask your own questions like, ability to have professional development, what are the plans in place for staffs for professional development. And if you're somebody who has a family, you can ask what are the plans in place for people with children, if they have childcare vouchers, if it's somewhere where they have welfare for staff, do they give free meal breaks, how many hours do you have, how many work hours do you have, and how are the shift patterns programs. Those are the kind of questions you want to be asking them on your interview day. And also you can be asking questions like cultures in the ward or in the care home. So this is you like trying to make them know you want to know more about that place before you work. That way you're prepared even when you're given the job to come to work with them, because at the end of the day you want to promote the culture and the things that are being done in the home or in the NHS. So you have to ask them questions like, what do you think are the cultures in the world, what are their expectations, and how do they help their staffs to grow professionally, or how do they ensure that their staffs grow and do not become redundant or feel redundant in their jobs. Those are the kind of questions you want to put across to your tell me about yourself. Now in this question you want to sell yourself and tell them that you're somebody who is confident, able to work under stress, who is resilient, who's able to adapt to the changes. Remember, you're coming from Africa or any other place and you're coming to work in the UK, so definitely the work pattern is different. So you want to say that you're somebody who is hardworking, works within a team, and knowing that you're going to be coming to work in a place where high standards of care are given, that you're somebody who is able to adapt to the changes, who is able to work well in a team and give your best as a nurse, inculcating the C's of nursing: caring, compassion, competence, communication, and courage. And you're somebody who can always be looked and relied on to give the highest standards of care to your patients at any given point in time, and ensuring the safeguarding of elderly persons in and around the hospital, and ensuring you're giving the safest kind of care to your patient and the highest quality of care to your patient. This is something you can use to say yourself. This question is just selling yourself, not just repeating that you're somebody who has a BSc, who has a degree, who has that, who that. No, you're selling yourself, your qualities, and how your qualities translate to quality healthcare delivery in the NHS or in the care home, whatever the case may be. Why do you want to work for our organization? It could be an NHS or it could be a care home. A simple answer to this question is to say there is somebody who works well with the trust values. Like I said, you have done your research about the trust values or the care values of the care home. So all you're going to be doing is saying, yeah, you've chosen to come to work with this trust or with the NHS or with the care home because their core values and visions align with your personal values as a nurse. And definitely once you align this answer to the core values of the NHS or the care home where you're coming from, or through their motto, you've shown them that really you've done your homework and you really want to work with them, so they will be happy to give you that job. What would you expect to do on a day-to-day on this job? Well, I'm sure with this question you should have read the person specifications of the job. Most job applications are the job description in the job, so you have to go and read out and understand those job description. It's those job description you're going to use to answer this question. For instance, saying that, well, according to the job description, I understand that I should be able to give the highest standards of care, ensuring that these patients are cared for. If it's a colorectal department, if it's a care home, whatever it is that is within your job description is what you should outline into this answer of what you're expected to do day to day, and just ensuring that you're going to be reporting to the highest level of authority in your trust or your care home, and you're going to be embedding the trust values or the care values of your care home into your day-to-day activities as a nurse, assessing your patients, planning their care, delivering the optimal standards of care to your patients at any one given point in time. Among the 6 C's of nursing, which do you think is the most valuable or the most important you can choose? Now, my answer to this question is that all the C's of nursing are very important. However, you can just decide to pick one and talk about it. You can say from all the whole C's of nursing, you think that your communication should be the best because you need to communicate appropriately to give the right care. You need to communicate appropriately to be competent enough to show that you're competent or to demonstrate that you're competent. You have to have a good communication skills to be able to give appropriate care that can be accepted by patients and their relatives. You have to be to have a good communication skill, to be able to show that you're courageous and that you're able to stand in for your patient. You have to have the right communication skill to be able to show care and compassion to your patient. Without communication, you're not able to demonstrate the other C's of nursing. However, you have to still show that these other C's of nursing are also relevant in the care of the patients and the C's of nursing. So even as you highlight a particular C and explain it, ensure you still go ahead to say that the other C's of nursing are also equally important and cannot be left alone. Another question you may expect to ask is, what is safeguarding? Safeguarding is a big one in the UK, so you have to understand what safeguarding is. And safeguarding is just you being in the forefront and being able to pick out signs of abuse, you being able to identify when a vulnerable group is being abused or being prone to abuse, and how are you going to ensure that you're looking out for safeguarding issues in your patient. This you can say you have to look on a day-to-day on your patients, probably doing assessments or examination or doing their washes, and also watching out for visitors and their relations with the vulnerable groups, and just ensuring that there's very safe communication among people and there's no awkward situations going on there. You're going to be someone who is very prompt and apt to identify things that are out of place and raise concerns to the appropriate authorities in the hospital, just so they can investigate and look into any concerns you may have about your patients. And safeguard means that you're doing all you can to ensure that the rights of the vulnerable groups are protected and they are free from harm and neglect, so they're able to live their lives free of harm and neglect or any abuse. So your duty as a nurse is that you're going to take the appropriate training that is given by the trust or your care home and be able to look out for signs of any abuse or neglect or any harm on the vulnerable groups, and be able to channel this appropriately to the appropriate quarters to ensure that those who are in these groups are actually safeguarded and protected from any harm or any abuse. Now, the also questions you can be asked as a nurse in your interview, the time is dependent on the setting where you're doing your interview, if it's an NHS or a care home or a mental health organization. So you have to look out for those policies that are very peculiar to these organizations. For instance, the 6-6 of sepsis screen in the NHS, where you have to take bloods, take urine, give oxygen, give 30 observations, give IV fluids. There are 6 steps. I'm not going to give you all, so go ahead and do your research, because I want you to also be able to find out these things for yourself. Look for the sepsis screen, look for the DOLs, look for the MCAs, mental capacity, the provision of liberty and the DOLs, look for things like safeguarding, look for these things and research about them. These are the things that are going to make you stand out. In the care home, you have to also find out on the mental health settings, look for things like incident reporting and how they are done, and be able to talk about them, because they could ask you this is just to see if you've done any research about the organization where you're coming to work and the things that are peculiar about them. In the care home, you have to also think about health visiting, the GP surveys, and how they come into the care home to care for their residents. You can think about even the nurse practitioners who also come to see these patients, the occupational health therapists, and all those social workers who come around to see patients in the residential home or in the care homes. So the peculiarities of your interview is dependent on where you are interviewed or being interviewed for a position. Now, you can also be asked personal behavioral questions about how would you handle a hungry patient, or how would you handle a situation where the workload or is more than the staff ratio. For instance, a nurse calls in sick. Well, first you have to answer these questions by saying, for instance, you're going to let the appropriate authority knows if there's any manager know if there's any provision for extra staff to come either through an agency for them to go ahead and plan for that. You're also going to call the nurse in question and find out about their well-being, just to show that you're someone who's caring. And you also have to go about to follow the protocol that is set down by the organization for sickness policy. Now, the sickness policy could be that you have to write an incident report, or just to ensure that something is documented so the nurse can get her sickness pay. Whatever it is, there's a sickness policy of your organization. You have to know it and follow it to the latter. Now, if somebody also calls in to have been bereaved or have a adverse situation, you also have to show that you know the hospital or the care policy in your organization and how to follow it to the latter to ensure that everything is done smoothly. Okay, so another question you can also be asked is, how do you handle stress? In the NHS, in the care home, anywhere you're working, there is bound to be a lot of stress. So how do you handle stress? Now you can answer this question and say you are somebody who works well under stress. However, when your stress begins to build up, you either go ahead and sing, go ahead and go out, try to talk to somebody. In some homes or in some NHSs, you have welfare departments that are able to cater for these situations. You have chaplains who you can go and speak up to. You have speak up champions and guardians who you can go ahead and speak to. People in recruitment, people in welfare, your managers, or even your minority groups in the hospital or in the care homes. You can actually speak to them just to let out these situations. And if you you're having a mental breakdown, you can also go ahead to meet the departments that's handling your welfare in that regard, just to ensure you have the optimal state of mind and can be able to give care to your patient. And if you need to see your GP, go ahead and do so, because at the end of the day, you have to take care of yourself to be able to take care of other people. Specific questions, like for instance, if you're interviewing for a surgical unit, you can be asked questions as how would you handle an emergency, low blood sugar, low blood pressure, what can you do as a nurse? For those questions, you can quickly say things like you're going to follow the hypoglycemic protocol in the hospital or in the care home, in glucogel, glucose tablets, checking the blood sugar within 5 minutes again to ensure the blood sugar has come back up. And if it's in the case of a low blood pressure, checking the blood pressure again, lying the patient flat and tilting the head side up to ensure that the blood goes back into the head, and then blood pressure also builds up. So things like that you can be asked. How can you handle a bleeding patient? What are you going to do? Things like saying you're going to ensure the environment is safe, applying pressure with your gloved hands, of course, upon the area, and using the gauze and dressing the place and bandaging it up. If you need stitching it up if you're allowed to, or referring the patient to tissue viability nurses or to the doctors to come stitch up the wound to prevent further bleeding. Those are the answers you want to give to such questions. How would you handle an angry patient? And you want to answer things like ensure that you're safe and the environment is safe, knowing when to break off, knowing how to escalate to your senior manager, following the incident reporting protocol to report the incidents, ensuring you speak to the family in a calm and good manner with a good communication skill to ensure you resolve the situation. And if the situation is not resolved, ensuring your senior managers know about it so they can come in and step into the situation. And if it's not solved, going further to the next step of conflict management in your organization. You should know the conflict management in the organization and how you can answer it. But the most important thing is that you have escalated the situation to a more senior manager in the organization. So you can be asked things about section 2, intercapacity assessment, and the likes of that. So you have to go ahead and read up all those things, because there are certain specifics which you should know about, and how you should also ensure that in any question that you're answering, you are focusing on the dignity of the patient and ensuring safety of the patient, and giving the highest maximum level of care to a patient at any given one place in time, ensuring your privacy of a patient and the confidentiality of a patient. How would you ensure confidentiality? They could ask you questions like, what do you understand by documentation, and what is the importance of documentation? Those are questions you can answer as a nurse. So just have an understanding, relate them to the patient care and patient safety, and to the trust values or the care values of the care home. Once you can do this, showing that you're confident, you are competent, and you are somebody who is able to relate to your patient and who is compassionate about the care of the patient and giving higher standards of care, you should be able to do well in any interview. Above all, don't forget to smile, be smart, be calculated, be together. Keep the aura of confidence and presence in your interview. Answer the questions to the best of your knowledge. Use simple grammars if you have grammars, do well, and enjoy your time. Be relaxed. Do not be scared, okay? Just show them you have good communication. Where you don't know the questions, you can always find a way around to answer that question by relating to something else, and just be honest and sincere in your answers. And find out the names of your interviewers, okay? Know the names of your interviewers, so at the end of your interview you can always say, thank you very much for having me, Emma, Julie, whoever it is that interviewed you. So know their names and have their names in mind. You can always send a thank you note to them even after the interview also, just so they can have you in mind after the interview. Okay, I know you will be fine with your interviews. You are skilled as nurses and you already know what you're doing. And if it's your first interview as a newly registered nurse, of course, Go ahead to do researches on these things I've talked about. Coupled with the knowledge you have already from nursing school, I'm sure you're going to be fine in your interview. And I'll see you on the side of success after your interview with your job offer. And don't forget to be the best you can be. Don't forget to like, subscribe to this channel, and share this video to anyone who needs to see this video. And I'll see you guys in my next one. Thank you for your time. As always, bye bye.